we're starting back up with laboratory tests. Our last class, we mentioned modifiable factors, and we went through lifestyle, hypertension, hyperlipidemia, obesity, diabetes, stress, and alcohol intake, and how they affect your heart and why they damage it. Now we're going to look at the laboratory tests and diagnostics. So we have the laboratory test, cholesterol. What should your cholesterol be? No higher than 200, right? So once your cholesterol is higher than 200, then that proves to be a problem. Triglycerides, I actually have a chart that comes next that tells you how high everything should be. So triglycerides, less than 150 is what's normal. Okay, cholesterol over here, less than 200 is normal. And then the HDLs, the LDLs, which one should be higher? HDLs or LDLs? HDLs. HDLs should be higher. And yeah, so that's there for triglycerides. Lipids or fats, right? We want to decrease our lipids. Troponin. So when we think about troponin and MB, CKMB, we're thinking about enzymes, right? They are, so if you remember, I don't know if you've done like injuries yet or for patho, like your body, once it's injured, it releases enzymes to tell itself that it needs healing, it needs help. And so this is what happens in the heart when damage is done in the heart releases troponin. It releases CKMB in order to signal the body that it is damaged. And so when we draw the labs, we can tell specifically what part of the body, the heart, that is damaged, and we know to look out for issues with the heart, right? So the other ones, so we have troponin, we have CKMM, we have CKMB, we have CKBB, right? We have myoglobin. Is it myoglobin? We have peptides. We have a few of them that once we see the levels, it signals us that there's a problem in the heart. Some of them are not specific to the heart. It just means damage in general, but the CKMB and the troponin are specific to the heart. And the other thing too is they have time limits, or so the troponin is the one that lasts the longest. So the levels of the enzymes stay in the body up to 14 days. So that's like for a person who had some kind of trauma, injury to the heart, and they're not feeling great, but it didn't cause a heart attack for them to like stop and go to the hospital right away. Or it's not an angina where they're like, oh, holding their heart like something is wrong. They don't feel it, but they just know something is off because of the fact that now there's a part in their heart that's damaged. It's not circulating the blood around the body as well as it should be. And so they start feeling some kind of inability to continue with activities or keep up with life as they used to, and that might trigger them in order to go to the hospital. Once they get there and they're going to take the levels of the labs, they're going to check and they're going to find all the others are gone. Let's say if it's a day later, 2 days later, 7, 8 days later, but they're still going to find troponin there, and they're going to say, oh, you had some heart damage, right? The others, you would need to get the test in a couple of hours to a couple of days, but with the troponin, it lasts at least 2 weeks, which is huge, right? So you need to know your levels, okay? So for diagnostics, we do stress or exercise test. That's a person on the treadmill or something, or someone given some kind of chemical to stimulate the heart and make it beat faster to see how it reacts. Is it pumping well enough? Is it getting the oxygen to the places where it needs to go, right? And then we have X-ray, MRI, CT, PET scan, which looks at the pictures of the heart, look at the blood vessels of the body to see how they're functioning. Are the blood pumping the way they should be pumping, getting to places they should be getting, right? Echocardiogram, we want to see how the image of the blood flow, transesophageal echocardiogram, same kind of thing, cardiac catheterization, that one. Same thing, looking into the heart to see how it's functioning, but it looks for clots, or not clots, but more like the space within the arteries. Are they wide enough, right? So when they do a cardiac catheterization, if it's occluded over 70%, they're going to make an intervention, whether it's a stent, whether it's clearing out, or whatever they need to do. But if it's less than that, they're going to tell the person to do lifestyle changes, eat better, exercise, right? In order so that the plaque doesn't continue to accumulate, the atherosclerosis doesn't get worse, so that it doesn't block that area in the future. And then they'll test them afterwards to see the progress, right? And then we have pericarditis. So if there's fluid in the space in the pericardium, they want to remove it. EKG, we talked about yesterday, your PQRST. How are the signals going? How's the heart doing with sending conduction through the heart to help pump the blood, okay? So let's now move on to the arrhythmias.